Good morning and welcome to our event today. Thank you for being prompt. We're just waiting for a few more people. So we'll just sort of give it another minute or two before we get going today. You can see we've still got people coming into the meeting, so we'll just give it another minute or two before we get underway. But welcome.
Always wish that Microsoft Teams had a lift lobby music
Yeah.
function for these sorts of moments.
Absolutely. But we have got quite a packed schedule, so I think we'll get underway in a second anyway, to make sure that we have enough time to give people time for questions at the end. Well, thanks everybody for joining us this morning. I'm Helen Northmore. I'm the head of digital and AI for the Life Sciences Hub, and I'm responsible for the digital health ecosystem for Wales, who is our, who are the organisation that is responsible for this morning's events. As you're probably aware, hopefully you're aware, we're a Welsh Government funded programme, which is a partnership between the Life Sciences Hub and Digital Health and Care Wales. And what we're trying to do is make it easier and faster to adopt digital healthcare technologies. And one of the ways that we want to do that is to talk to you about systems, talk to you about how things work, talk to you about our work. And so that's the idea behind today's event. And the idea is it's just quite an informal opportunity for you to find out what we've been doing and as part of the team, and to be able to ask lots of questions. So what we're going to do is get underway, but first I have got a couple of housekeeping announcements. So first of all, and I know most of you already have, which is brilliant, can you make sure that you mute your microphone and that you keep your camera off throughout? We are recording this, and this will go on YouTube after the event, and we don't want to necessarily have you up as part of the audience. We want to make sure that it's that the event is focused on who's speaking. There is a healthy chunk of time at the end for question and answer and discussion. If you can put that into the chat, any questions that you have during the event, during the presentation, we will pick those up at the end. And also please use the chat responsibly. And as we said, we'll put it up online. So there is that will be on our website, digitalhealth.wales, and we also have a YouTube channel. So please do feel free to look at that. And we've also got a lot of our past events available on there, which should, in case you want to find out what we've been doing with our most recent event was on April the 14th, where we looked at the digital strategies of Cardiff and Vale, the Welsh Ambulance Service, and a programme called Digital Services for Patients and the Public. And so that was, and there's events going back, I think, a good couple of years, so you can see what we've been doing. So that's the housekeeping out of the way. What I want to do now is introduce our main speaker, who is Hugh Angle, who is part of the ecosystem team, and he's going to talk you through interoperability in the time of COVID. Hugh, over to you.
Thanks, Helen. Just give me a sec. Should have got that ready. Okay. Helen, can you see the screen okay?
Yes, that's great. Thank you.
So yeah, good morning, everybody. As Helen mentioned, I am part of the ecosystem team at Digital Health and Care Wales, which is normally shortened to DHEW. Not at all confusing with the DHEW acronym, but there we go. So DHCW, we're an NHS Wales organisation, and most of what we do is to provide digital solutions to other NHS Wales organisations, such as local health boards and the Ambulance Service Trust. So our organisation's been pretty busy during the pandemic, as you could probably imagine, having to quickly respond to the need for new digital solutions. And I thought today it would be kind of interesting to give an overview of some of the work that's been done and try and put it in the context of some other ongoing projects that have the aim of improving the way that NHS Wales systems interoperate and opening up those systems to others. So let's start with a bit of a reminder about what it means, the times of COVID-19. So this is my interpretation, but I kind of see it as three key phases. So first being, we realize there's a new virus on the loose. And even though we didn't necessarily have widely available tests, we did still need to make sure we could record suspected cases where it's diagnosed, and also to make that data available to decision makers. So sharing statistics through Public Health Wales. Then the second phase, so when tests were available, we just needed to make sure that we could actually handle that volume of test requests going into laboratories, and also, again, making those results available to the right people, contact tracers, etc. And then, yeah, the last more joyous phase of the pandemic, perhaps, the vaccinations. So vaccines became available, but then we had to suddenly schedule a vaccination for every person in Wales, which isn't something you do every day. And after that, also to make a record of the vaccination available for things like the vaccination certificate program. So along the way, we've picked up quite a few bits of new vocab. I don't know about you guys, I wouldn't have placed a bet on PCR and mRNA being a dinner table conversation a couple of years ago, but we might be headed that way. And what that's meant for NHS Wales is just that there's a lot of new terminology that systems now need to exchange and to make use of. Exchange and make use of, I'm being kind of precise with the wording there, because that's the definition of interoperability. At least that's what Google told me. So the ability of computer systems or software to exchange and make use of information. So today we're going to look at how that's worked out for NHS Wales during the pandemic. What we're going to take a look at is 4 examples. So the first 2 are where you've got existing systems that have had to interoperate in new ways or make use of new data. And the second 2 are new computer systems that have been created by teams at DHCW. And those are brand new computer systems that have needed to integrate with other existing systems, so to interoperate. One quick disclaimer, this is not going to be anything like a technical deep dive into those projects, and it's actually only a fraction of all the work that's really been done in response to COVID-19 for NHS Wales. But hopefully it does give you a flavour of the current state of interoperability and help you to sort of understand the context of other projects that are in the works to try and improve interoperability, particularly around standards. So I'll get into the first example, and this is the Welsh Clinical Portal. So Welsh Clinical Portal, it's a web application which was originally used by clinicians and staff in hospitals. And essentially what it is a dashboard into the patient record. So it's a web app that connects to other key national systems holding patient records. So things like the Welsh Care Record Service, which holds a lot of different clinical documents in digital format, and the Welsh Results and Reporting System that holds pretty much all the test results. So that's kind of a single pane of glass into the patient record. And as I mentioned, it was available to clinicians and staff in hospitals, but wasn't previously available to GPs. And to facilitate that that first part of the pandemic where you had GPs ways of working changing quite a bit and needing access to more data. So GPs can now access the Welsh Clinical Portal. This is a bit of a cheat because the interoperability part, the system to system, hasn't actually been done, but it's in the works, and I think it's interesting to discuss. So there's GPs use their own systems that are installed on their own computer system. So that holds pretty much all the GP record for a patient. And there's plans to be able to seamlessly launch the Welsh Clinical Portal from the GP system. So what that means is rather than a GP having to go and they've got the patient record pulled up in their GP system, they don't have to go to WCP, log in, and then search for the patient all over again. They can just launch and go straight into all the things that WCP gives you. So the things that facilitate that are a few predefined interfaces. So we've got an application called the GP portal, which is essentially just a sort of a light wrapper around the GP system that has a defined interface to retrieve the patient context. So essentially says what patient is the GP currently looking at on the system, and then when they launch another application, it can retrieve that context and pass it across. So the goal would be for the Welsh Clinical Portal. It does already offer an interface for launching into the Welsh Clinical Portal called the reverse stapling interface. Don't ask me why it's called that. But what that enables is essentially a nice sort of seamless launch from one system into another, viewing the same patient record. So there's example one. Second one is quite a different example. This is where we've had to take results in from, I'm sure people have heard of Lighthouse Labs. So if someone thinks they have COVID or not completely au fait with all the circumstances where they go to the community testing unit, but they can book a test. Their swab will get sent off to a Lighthouse lab, and then the result will need to come back through and go into NHS Wales systems. So things that needed to be set up for this was essentially landing the data with NHS Wales. So that uses a something called Mesh, which people involved in healthcare will probably be fairly aware of. It's a kind of almost like a mailbox for files is probably the easiest way to describe it. So the data comes across from actually NHS Digital. So the bulk of the process is managed external to NHS Wales. But once it's landed in, there's then a data pipeline that relies heavily on some sort of predefined interfaces. One is using something called the HL7 version 2 standard, and that's so retrieving patient demographics. So when we get the record in from a Lighthouse lab, we don't necessarily know the patient in the same way that it's known externally, but we can, using the demographic information, actually identify how we know that patient in our systems and attach the correct information to then pass it across to WLIMS, which is the Welsh Lab Information Management System. And again, using this HL7 standard, which is a standard format for healthcare data. So it's passed across to that system. And then there's interpretation of the pathology test code, which is done using something called the Welsh Pathology Handbook. Now this holds essentially all the different tests that you can do in labs in Wales. That's listed in the Welsh Pathology Handbook. So it's you can think of it as sort of a big code lookup dictionary for oh, this is the test you want. Okay, that's what we know as this particular code. So as I mentioned, where we're talking about new tests, that's new entries in that handbook to identify what those tests are. The second example, this is somewhat related, but slightly different approach. So this is where the rather than the tests being done in Lighthouse Labs and then sent through to NHS Wales, the they're actually being done in NHS Wales labs. But as I mentioned earlier, that it's handling this volume of test requests and very specific set of tests. So a new system was set up to facilitate this. I think it's called the Welsh Pandemic Record. I might have got the terminology wrong. That's referring to something slightly larger. But there's a test center dashboard, which is part of that. So essentially a web app available to people in test centers, and that connects through to the Welsh Results and Report Service, WRS. And essentially it's enabling, I guess you could call it interoperability in the real world. So the dashboard app can connect through to that service and say, how is this lab order being sent? It's going to be identified by something called an episode number. So it generates a barcode and a label to attach to that specimen. So whether it's blood, whether it's a swab. So that barcode gets attached to that, it gets sent off to the lab. When it gets to the lab, they can just scan the barcode and by the magic of interoperability, facilitated again via HL7 messages between the systems, the lab information system is already expecting the specimen with that number to arrive in the lab, and so that the results can get linked up properly. One thing that had to be done for this was actually to provide a new API out of that Welsh Results and Reports service to facilitate the dashboard doing that, because it's the existing API was very much focused on things like GP systems or hospital systems, where you're selecting from a wider array of tests. This was a very specific need to. We know it's only one test pretty much that's going to be requested. We just want to get the label. Just give us that. Don't give us all of these extra options. Yeah. So the last example, just to take a look at, is to do with the vaccinations. So there was a new system set up called the Welsh Immunisation system. So pretty much a brand new system created from the child health system, which already took care of scheduling immunizations for children, but not anywhere near on the scale of the COVID-19 vaccinations, obviously. So the first challenge of this was getting into that system, letting it know which patients exist in Wales that need to be vaccinated. So there's a process that used the Welsh Demographic Service, which so WDS. Now that holds essentially a record of every patient living in Wales and registered with a GP, and it provides a date of birth, their address, and everything. So it's useful information to use for planning the cohorts that need to be vaccinated in which priority order. So there's a process to batch load that into the Welsh immunisation system. But then obviously once you've loaded that data in, it's likely to change. People are still moving and dying and changing their surnames possibly during the pandemic, and therefore that needs to be kept up to date. So essentially what was set up was the Welsh immunisation system listening in to a message flow that already exists. So we have a central master patient index that facilitates exactly that flow of messages of different systems saying, hey, I've got the patient registered and they've just told me that they've changed their address. Maybe let every other system know this. You can kind of think of the master patient index sort of sits as a hub between those different systems, accepts all of these messages, and it actually ties together all of those different patient records and says, okay, the patient's known in this system here, and this system here, and this system here. I can see that these are actually the same patient. And so when this system says the patient's address is updated, I can broadcast out a message to all the other systems that hold that patient record to let them know that the address has changed. So facilitated by the Enterprise Service Bus, which is essentially just a big message handling service, if you're not familiar with the concept. So you configure routes in there, and it was a matter of configuring a route through to the Welsh Immunisation service. And then the last bit was, as I mentioned, sharing this vaccination record. So the Welsh Pandemic Record app I mentioned earlier, it doesn't just now have the test centre dashboard, but it also has a facility for generating the vaccination certificates that are currently being requested by a few people. And there's a new data flow that's being sent out from that. So essentially saying these people have been vaccinated, this person's received 1 dose, this person's received 2 doses. Oh no, actually this record was incorrect, please remove it. All of those messages again flowing through this enterprise service bus out to other applications like the Welsh Pandemic Record system. So that's a quick run through a small selection of the work that's been done and a bit of an overview of how interoperability currently is working in NHS Wales. I guess the question is, so interoperability mission accomplished? Oh, are we done? Do we need to do anything else? Well, you might have got the feeling from watching that. So yeah, you can see it's the systems plug together and they can talk to each other. But it's not quite as seamless, or you could just plug anything in and get it working. So there's still a lot of local standards there. So even those messages that conform to this HL7 standard, HL7 is sort of commonly known as the non-standard standard because there's a lot of ambiguities in some of the definitions that allow, or perhaps not ambiguity, but flexibility that allow for it to be interpreted in different ways. And that's somewhat corrected in newer standards like perhaps FHIR and OpenAir. And I guess the other thing where I mentioned the Welsh Pathology Handbook, so that's those are all locally defined test codes. So in many cases local to the health board, and potentially we could be interpreting data that's more widely understood, something like the definitions defined in SNOMED CT by I think it's NHS Digital Lab. I'm not too familiar with that there. Perhaps there's someone who can fill us in later with that. So, and again, that first example I showed, so the Welsh Clinical Portal launching from a GP system. So although we have that this way to do it using the existing interfaces, so the interface into GP systems is it's actually called the WCCG launch interface. It's from an older system that still exists. And the reverse stapling, there are more modern ways of achieving that same kind of integration, such as Smart on FHIR. And so if we were able to offer that kind of interface, then that also means that a new system could just pretty much plug straight in if it's already implemented a Smart on FHIR integration before. The other kind of things that sort of make it not quite plug and play is barriers to entry. So at the moment, although I showed a few of those flows between different systems using APIs and messaging, the access to APIs is very hard to get at if you're not an NHS Wales organisation. Sometimes if you're not even DHEW, it can be quite difficult to get the access rights to that versus having, you know, an open app registry where anyone can come and register and have a consistent mechanism to secure those APIs. And the updates through the message flows through ESB, it does require some manual configuration by the team that manage the enterprise service bus, versus something like a sort of a publish subscribe model where you basically list these are the messages you can subscribe to, they're being constantly published. Just it's sort of open registration. And as I mentioned, actually, did I mention this? Well, there's some bumps in the roads. So passing data between systems. Some of the things that I've been aware of and some things I've helped out with. So where you've got legacy data, so even though both systems are using some standard sets of codes, it turns out that the one's using an older version of them, and therefore that when the data gets passed across to the other system, it's like, I don't know how to interpret these. What are these codes? And then another interesting issue is actually definition of data sets. So one interesting thing is the immunization program. They decided to go with anybody who's registered with a Welsh GP. But you may have remembered from earlier when I mentioned about the Welsh Demographic Service that actually holds a cut of data of anybody that lives in Wales. Doesn't actually matter which GP they're registered with, and so that caused some complications when they're trying to extract that data for patient cohorts. It meant that we ended up having to sort of receive a small batch of patient data from NHS Digital in England to make sure that we got everybody immunised who's registered with the Welsh GP practice. So what's in the works that might help resolve some of those issues? So during the pandemic, there's been a few things that have actually started up. So a new interoperability working group, and that's also led into some collaboration with NHS Digital and the other 4 nations on UK Core. Some new standards-based systems. So we've got a new terminology service being rolled out shortly, and a clinical data repository that are both conforming to different to modern standards. And there's other work that's in progress around trying to open up the architecture and make it easier to get access. So let's take a look at some of those things. So first, the Interoperability Standards Working Group. So that's the goal of this is to support adoption of standards such as FHIR and OpenAir. Not just those two, but those are a particular focus. And the group is there to review and advise on relevant projects and proposals. So it's been meeting since, I think it's 14th of September was the first meeting, and chaired by Mark Frayne, who's an architect in the NDR program. Also works for DHEW. And I guess the thing that's kind of unique about this is it's bringing together members from all the different NHS Wales organisations and health boards, which commonly haven't had such a forum to meet on a monthly basis and actually look in detail at some of these things that are happening. So there's a few examples of the projects that they've taken a look at so far. So the terminology service, as mentioned, and the clinical data repository. There's also been some work to try and resolve issues around standard formats for receiving patient recorded outcome measures. So these are questionnaires that get sent out for patients, and they're looking to define a common standard to make it a bit more flexible about any application could actually collect the questionnaire data and send it back in. But in order to do that, we need to define a standard format for that. So that's an example of something that the working group has been taking a look at. The UK Core FHIR Profiles. So this is actually in some ways a separate project, although it's linked into the interoperability group. So this is a collaboration between, as mentioned, NHS Digital in England and also NHS Wales, NHS Scotland, and forget the name of the NHS type organisation, Northern Ireland. But this is plans for adopting a common approach to FHIR. So FHIR is essentially the new HL7 Fast Health Interoperability Resources standard. So it defines a REST API and some common data structures for use in healthcare. And what it doesn't do is be overly prescriptive about how you use it. But for the UK, we want to be a little bit more prescriptive so that we can say, well, if you've got a patient represented in this format, then it can be interpreted by systems in England, Scotland, Ireland, or Wales, Northern Ireland or Wales. but it also needs to accommodate the fact that there are some differences in data standards between those nations. And this, so that program of work, it's going to be led by the a UK FHIR board that had their first meeting in May. And as I mentioned, membership from all the 4 nations, and Wales being represented by the NDR chief architect, who's Rob Jones. You can find out more from the link that I put at the bottom of that slide if you're interested. So some new standards-based systems. So I mentioned the terminology service and the clinical data repository. So terminology service is currently being rolled out. I think it's in pilot for a few uses at the moment. It provides a FHIR API, and it allows you to essentially do advanced search and filtering of SNOMED CT codes. Not just that, it's actually will host a range of different reference data sets, but SNOMED CT is a sort of the particular selling point of using this service. And then the clinical data repository. So something else that's in the works, it's got an open air architecture. I think there's some discussion around whether it should also expose a FHIR API, but that's that's a hot topic, so I'm not going to get too into it. I guess the important bit is that it conforms to open air, which is a much more let's say ambitious standard than FHIR. So it proposes a standard not just for the interfaces of the system, but the actual internal data persistence model, in a way that it's sort of easier to sort of migrate data across from system to system, not just communicate between them. And the initial use of that CDR is for allergies and adverse reactions, but the plan is that it will be available for much more data as we go forward. So other work on opening up the architecture. So the first point is the one that I'm actually involved with, which is proposals for an API management platform. So as I mentioned, currently trying to get access to APIs can be very tricky, even if you are an NHS Wales organisation. Each system exposes APIs with different types of security mechanisms in place, some using cryptographic certificates, others will use some other kind of security token, others will actually be heavily restricted by firewalls and others not so. What we're looking to do with our proposals that we've put forward is to create a much more consistent layer of API security using an API gateway, and one that supports modern and commonly used security mechanisms like OAuth 2. And we're also looking to integrate that with our NHS Wales developer portal website. So currently that hosts some limited documentation on APIs. We're looking to add more documentation there. So the ultimate goal being that you can actually just go to that website, browse the API catalog and find the API that you want to use. You'll find the documentation there too, and you'll also be able to request access, and that will be linked up to this this API management platform to set your request to pending, and then you can go through jump through all the hoops of proving that you're you're worthy of access. And then another thing that's happening, kind of related to opening up the architecture, that there's things in the works around looking at publish subscribe models for messaging. So as I mentioned earlier, with the enterprise service bus type model, it relies heavily on the team configuring those message flows, whereas a publish subscribe model would mean you can actually discover the data that's available and subscribe to it. So one example of that is a web push API that's currently just used internally for the Welsh Clinical Portal mobile application, which allows people to subscribe to notifications for a patient test result. And then the other thing that's been looked at, or actually already in use in some health boards, I believe, is use of Apache Kafka for streaming between federated data resources. So this is the LDR, NDR, so a local data resource, national data resource, so a federated model to providing a national data resource built from local data resources, and using streaming between them to share the data. So I think I'm done talking. Sorry, I went for a little longer than expected, but haven't taken a look. Hopefully everyone's still there. And I'm not sure if we've got some of the architects from DHEW on the call, but I did ask if they could join to help me when I get stuck in the mud for questions, but let's see what happens.
Thanks, Hugh. And that was a really great run through of some of the challenges and opportunities and activity that's happened over the last few months. So just a reminder to everybody that we have got about 20 something minutes for some questions. We really wanted that to be, a good part of the discussion rather than just trying to find a few minutes at the end, because we wanted this to be a really interactive event. So please do feel free to put questions in the chat. We've had the first one from Mark Smith, who said that we're supporting a national COVID programme in France where COVID tests are being sent in real time from all labs across the whole of France using our interoperability technology based on FHIR. Is this an area of interest to the team?
I would imagine it is probably of interest to the team. I'm just trying to look through the chat to see if anybody is...
Yeah. So I think, Mark, the key thing is send us an email to digital@lshubwales.com, and what we'll do is we'll make sure that we'll sort of put you in touch with the right people. So while people are thinking questions, I have one for you, Hugh. I mean, obviously, it's been a huge learning opportunity over the last 12 months. What would you say have been the thing that you've learned the most, particularly if it was something you didn't expect?
It's interesting. I'd say one of the things I learned the most is actually what we have is not necessarily as bad as some people sometimes might feel it is. So I think there's a lot of people involved in work looking at the standards like FHIR and OpenAir, and it can be a bit of a thing of, oh, why aren't we there yet? Why aren't we there yet? And it can make you look a little bit downhearted on the current system, where we do have a lot of legacy systems that still conform to old standards. You think, oh, this isn't great. But I think the fact that we've been able to deliver a lot of these things quickly and to integrate them well in a short space of time has sort of made me a little bit more, I wasn't optimistic is the wrong word, because I'm still hoping that stuff will be gone in future, but it's nice to know that we're not as far away from this shining tire on the hill as we might think we are.
And you talked about a number of things that are happening, or about to happen, that have been sort of the next stages in the process. Which of those do you think is the most important? What would be your, this is the thing we need to do next item?
Oh, well, I'm clearly biased because we've put proposals forward for this API management platform, and that's the highest priority for us at the moment. So we did a lot of work in the latter half of last year and the early part of this year, just really refining what it could look like for DHEW and then for NHS Wales to provide a nice straightforward way for people to get access to systems, because I think you'll be familiar that a lot of our challenges with the digital health ecosystem project at the moment are people sort of banging on the door and saying, oh, we'd love to integrate and be great, but we haven't quite figured out, one, the technology, and two, the governance, and this will at least solve point one, the technology. There's still things to figure out about the governance, but as we know, that the change from NWIS to DHCW as a special health authority and other things happening will hopefully resolve some of those governance issues alongside that. So.
Can I jump in at that point, just in terms of the governance stuff? So I think, so Dav Loughlin from Concentric Health here. So I think from a supplier's perspective, that's one of the, those two things need to be sorted. Otherwise, suppliers come and kind of, engage with great people like you, get prototypes there, and then actually you can't do anything with it in the kind of real world in prod. So, we need some clarity as suppliers of what those timeframes are, so that it makes sense for us to engage. Because otherwise, we can play with test prototypes as much as we want. It just doesn't make any sense to do so as a supplier. So we need clarity of, technically, as Hugh says, we can do nice modern stuff. We can do more legacy stuff. Technically, you can get over the line with that stuff. It's fine. More of the challenges around the governance and around, internet facing APIs and all that kind of stuff. Where are we with that? Should we be talking to you or not?
Jump in there with a tough question, Dev.
Pleasure.
Where are we? So you put me in a slightly tricky. I should have prepared for it because it's perhaps an obvious question. So we're preparing to go out and buy some things to enable the API management platform. So I'm struggling with not being too au fait with procurement rules, exactly how much detail I can discuss on that, but we're expecting that later this year we will have an API management platform in place. As for the governance aspect, which I think is actually probably the bigger sticking point in your case, I'm less clear on timeframes, and I'm not sure if there's anyone on the call that would be comfortable jumping in and answering that question.
I think your challenge though, Dav, is one that's been thrown up in a number of places. So we've been working on the Digital Solutions Fund pilots, and part of that work with each of the pilot companies has been mapping out what the requirements would be to allow for third-party integration. And there are some really sort of learnings that apply to everyone that are coming out of that. So one of the things that we're keen to do as we go through that process is to be able to provide much more guidance around the process and the expectations, so that it's much clearer about if this is the path you want to go down, particularly around that it's being able to say, well, this is the steps, these are the processes, this is the likely timescale. Because I think the challenge is, until now it's been unknown. If you're not within Digital Health and Care Wales or the NHS, I think as a supplier, it's been very difficult to understand what that process is. So we're hoping to bring some light to that during this year, and to be able to really be more transparent about those expectations and processes.
Yeah, thanks.
Great. Any other questions coming from the chat, not just from the chat, but from participants here today? Sometimes feel like I'm actually doing a bit of an interview with you, Hugh, which is great. I get to ask all the questions. So once the API management layer is in place, I mean, for those of us who are perhaps less technically minded, what will we see that's different? That's going to make that sort of understandable that it's a step forward.
So I guess the first people to see something different will be potentially people managing applications for DHEW or with an existing relationship with DHEW to connect. So whereas currently you might have to be managing, as I mentioned before, different security mechanisms to connect to sort of 3 different APIs, you'll actually be having a single set of credentials you can use for your application to connect through, and you'll have a very straightforward way to request those credentials in the first place. So particularly if you're coming along for the first time wanting to connect to perhaps the terminology service or the master patient index, you just go to one place, you go, right, this is what I want to access. you get back a response. Okay, here are the credentials, and then you've got access to both systems potentially in one go.
That's really helpful, thank you. We've had a question now from Marcin, and apologies if I've mispronounced that. How far are we into Apache Kafka research? It is an NDR idea as far as they know. Is that not a concern?
I notice, sorry if this is pushing you in it, Andrew, but Andrew Parton, I see you're on the call. I wonder if you're aware of anything outside of NDR with Kafka, and I'm not quite sure what it means. Why is that a concern? If you want to clarify that one. Oh, you're on mute, Andrew.
Great. It's very much been spawned by research within the NDR program, and like you said, Apache Kafka is not really research anymore. It is actually in play. You know, we are using it for Welsh Ambulance Service Trust data, and Cardiff and Vale are using it to send cancer data to Velindre. It's very much part of the NDR program now, and it looks like that would be the data movement tool within the, especially the federated part of the NDR between health boards. We're unsure where DHEW and the NDR, whether they're going to run with Kafka as well alongside the health boards. But I don't know where it would be a concern as such. So I don't know whether if Marcin can elaborate a bit further on that.
Marcin, would you like to jump in to clarify? Well, hopefully that's answered your question. One thing that I am going to ask now, just before we carry on with the FAQs, sorry, Q&As even, is that we'd like to just get some views about this event. And this is the first in this more sort of informal discussion process that we want to go through. So what we'd like you to do is just to answer a couple of questions. First of all, would you recommend this event to a colleague? Have you found it useful? But I think very importantly, what topics would you like to see being discussed in future events? Because then we can that can help us shape these programs. We'd like to hold these about once every sort of month or so, as that opportunity to really discuss with members of the ecosystem team and associated Digital Health and Care Wales colleagues, these more technical topics. But that's very much sort of requires your feedback on what you're looking for and what you're going to get out of these. So if you'd like to go to menti.com and enter the code 45415253. So as you can see up on the screen, we have got live questions, and so we can see your responses coming in. And thank you very much for saying that you would recommend this event to a colleague. And also, if you've got any feedback, again, please email us if you want to go and think about topics or consideration, you know, to digital@lshubwales.com, because these events will be useful if you let us know what's going to be helpful. Otherwise, we're going to end up talking about what we think is important. And you know, that's obviously easy for us to sort of want to talk about what we're doing, but really we need that feedback from yourselves. So I don't know if we can move on to the second question on sort of topics. Well, if you do think of ideas, please do contact us or DM us on Twitter, send you or me or an email or however. But also during the next couple of questions, if you think of topics that you would like to see us cover, please make sure that you fill in the Mentimeter. So we've got about 10 minutes left, so that, sorry, I'm just making sure all the technical, too many screens. Dav, you're jumping in. Have you got another question?
Well, in the absence of any other questions. So listening to you talk here, I mean, during the last year, obviously what you've done has been kind of different to what you were doing the year before. You know, as most of us will have, you know, ended up doing different things during the pandemic to what we were, you know, planning to do, as it were. And probably you would agree that in many ways what you and the team have done is kind of been integration engineers rather than necessarily the kind of separate team doing kind of, you know, almost like kind of green shoot projects that maybe you were doing the year before. And as a kind of reasonably capable team as part of the DHEW kind of cohort, there's probably a risk that you just get kind of brought into those kind of standard projects or kind of integration projects. You guys kind of know how to do that integration stuff. Is it time now to kind of have a reasonably hard line to say, right, we're not going to do any, you know, this team are not going to do any HL7v2 projects or, you know, SOAP projects and that kind of stuff now. We needed to do it for those 12 months or 15 months. But now we're going to say, you know, we are not doing that anymore. We are only going to do these kind of, you know, greenfield kind of future projects. Is that the kind of plan? Are you getting to that point where you kind of stop saying yes to kind of those things that you've been doing?
So I guess one first thing is maybe just to clarify. So those 4 examples I talked through, then not necessarily things that our team has worked on directly. So I'm sort of sharing. Perhaps should have made it clearer, but I'm sharing the work that some of the other teams have been working on. That said, members of our team did get sort of temporarily seconded to work on quite a few of those projects. So yeah, I think the focus of our team has not actually changed over the course of the year, but what did change was just how much resource we had available because we had people missing off on other projects. So really the main thing that we did as a team was put together those proposals for the API management platform that I mentioned. So our focus is still very firmly on newer ways of doing interoperability. Perhaps what's changed a bit since we worked together on this sort of prototype FHIR API for the Welsh Care Record Service and seeing how that could integrate with an app like Concentric, is that there's these other, so the Interoperability Working Group is now there, and that's sort of taken over a bit more responsibility for figuring out what these new FHIR standards will actually be. And I think we've always been very clear that we're not really a standards team, but we need standards to enable the work that we want to do. So if you want to open up an API, that's great. But if you want to make it nice and interoperable, it needs to conform to some standard. Who actually decides those standards? Well, now there's this UK Core FHIR work, and there's Interoperability Group to help with that. So yeah, I'd say that the focus of our team hasn't changed drastically, but we are being realistic in what we can do because we know that standards work is happening. We've got to wait for it a bit. We're focused on pushing through the API management platform, getting that in place. Hopefully by that point the governance is all sorted for us and we don't need to worry about it. I'm sure Helen can sort that out, knock some heads together.
Easy, no problem. That's just the
yeah, and then in the meantime, I guess we are continuing that sort of green shoots work. I guess sort of trying to look at what's possible, but as much as possible tying it into projects that already exist. I think when we worked with you guys, it was always going to be a bit difficult because the governance process doesn't necessarily favour applications like yours at the moment. But there's other projects such as the digital solutions for patient and public.
Yeah,
that's got a lot of momentum behind it and looking at patient-facing apps. So we're really looking for opportunities like that where we can sort of, I guess, jump in and let the momentum of those projects carry us through to delivering some solutions rather than betting on the wild cards.
Yeah, cool.
And it's just another opportunity to highlight that we had a great presentation from Stephen Frith about digital services for patients and the public at our last event. So you can go onto digitalhealth.wales, DHEW and find the details of that event if you want to catch up on it. So we've got about 5 minutes left, but I think we've exhausted the questions. So I just want to thank everybody for their participation today. And again, please give us feedback if this event is useful or what you'd like to see us cover. And then we can sort of build this into a bit of a programme for the rest of the year. We obviously won't have a meeting in August, because hopefully most of us will be able to take some time to relax and have some vacation or holiday even during the summer. But just want to thank you and thank all the people who've asked questions and thank the team who've put the event on today. And please get in touch with us for any feedback, questions, or you want to know any more details. And it's digital@lshubwales.com, or you can find us on Twitter at DHEWales or digitalhealth.wales. Thank you very much.
Thanks.